Hey YouTubers, something important, something kind of damn important. So today is Miracle Thursday right now. So yes, Miracle Thursday right now, like the big ass cigar. So also not a doctor for the last damn time. Neither am I a patient or survivor myself. My usual disclaimer. So anyway, talking about right now essentially type 1 diabetes and quitting tobacco. So you have tobacco, cigarettes, cigars, and pipes, chewing tobacco, dipping tobacco, snus and snuff and vaping, and hookah. And then you also have type 1 diabetes. So type 1 diabetes, also known as juvenile diabetes, is not the diabetes you get from obesity or high blood pressure or elevated cholesterol levels. This is the type of diabetes that people get when they are younger, when they are, potentially in their, their childhood, childhood diabetes. For example, you might get this as young as 5, 10 years old. So this is not to be confused with the type of diabetes that people get from being severely overweight or obese or having, elevated blood pressure or eating fatty, greasy foods. So this is basically juvenile diabetes. Okay, enough rambling. So type 1 diabetes and quitting tobacco. Now, my usual disclaimer, if you're not a smoker, please, please, please don't start. It's not worth starting. Whether you smoke cigars and pipes, whether you smoke cigarettes, it's never worth starting. You're not a smoker, please, please don't start. I'm a hypocrite, I'm a smoker myself, so, don't flame me myself. But if you're not a smoker, please don't start. Now, if you do smoke at any point in your life, whether you have any health problems, always, always, always quit smoking. The sooner you quit smoking, the better. Obviously, I'm a hypocrite again. I'm never going to quit smoking myself. I'm never going to give up the cigars and pipes, big ass cigars, big ass pipes. If you have type 1 diabetes as a young adult and you are smoking, it's a very bad combination. It's a very dangerous combination because you could be potentially putting yourself at risk for vision loss, amputation, kidney disease. So you want to be very damn careful, very damn careful. Now, cigars and pipes in moderation, I'm not sure. Even that I wouldn't recommend. If you have type 1 diabetes and you've had it since you were a little kid, I would not recommend, smoking cigars and pipes. I mean, I wouldn't recommend smoking cigars and pipes in the first place. It's never a good habit to start, even though I'm a hypocrite myself. But yeah, if you have type 1 diabetes, I would not recommend smoking at all. If you do have type 1 diabetes and you do smoke, unfortunately, you do frickin' smoke, it's really time to quit because you don't want to lose your sight, you don't want to lose your vision, you don't want to go blind, you don't want to have kidney disease, you don't want to potentially lose a finger or lose a toe or lose a leg. It's like, not a good thing in general. It's just a really bad fucking thing in general. And I know it's hard to stop, especially cigarettes, because they're very physically addictive, but there are ways to help you. There's a patch, the gum, the inhaler, there is medication you can take to quit smoking. It's never a good thing. So, I mean, I'm biased myself because I don't have diabetes. I don't have type 1 or type 2 diabetes. I'm not even pre-diabetic myself, so I'm completely biased here, but it's never a good thing. So, if you have type 1 diabetes, juvenile diabetes, and you're a older teenager or a young adult or even a middle-aged adult, it's really time to stop smoking. I can't force you, nobody can force you, but it's a very dangerous combination. It's the same thing I talked about on Tuesday with somebody who's morbidly obese, somebody who's 500 pounds, who's smoking a pack a day of cigarettes. It's terrible, it's fucking terrible for your heart. Anyway, have a nice day, bye-bye.